So here we have an example of the exposure control plan. This video gives an overview of the different components of what the exposure control plan encompasses. Now this sample is available to download on the resource page or through the Oregon OSHA website. The purpose of a written program is not just to meet OSHA regulations, but to make sure that you've accounted for all the variables, and that when a person who is in charge of your exposure control plan leaves, that the replacement knows exactly what to do. As with any example of a written program, there are fields that need to be filled out. This is very important to make sure that you go through and fill in all the blanks. Starting with the program administration section, we really get into the nuts and bolts of identifying who is in charge of what, which makes this an area that is especially important to pay close attention to. Sometimes you will want to fill in the name of the person, but you will also want to make sure that if that person no longer has those responsibilities, that you change your program to reflect that. Or you can simply identify a position so that it remains current, even if that person in that position changes. Next, we have the exposure determination. Now, when you do your initial determination, you're going to want to identify which employees are always exposed to bloodborne pathogens, employees who are sometimes exposed to bloodborne pathogens, and you're also identifying tasks that can expose employees to bloodborne pathogens. So, here's where you would want to include the job titles of people that could have that type of exposure potential. For example, a phlebotomist can't draw blood without being exposed to blood. In methods of implementation and control, you begin by stating what level of precautions your program is following, whether you are following universal precautions, standard precautions, or body substance isolation. This is where you want to say that. You want to identify who is responsible for keeping this program up to date and who is responsible for reviewing it annually. The exposure control plan talks about the person, job title, department, or whoever is responsible for making sure that the initial training for employees is completed and that the plan is annually reviewed, especially for smaller sites and larger hospitals. Say, for example, a hospital with an infection control department. Well, they're probably going to be the same department doing both the training and infection control. In engineering controls and work practices, you identify which engineering controls your company uses, and that's also going to include your Sharps devices and your safer medical devices. This is going to include what you are going to do with Sharps containers for used Sharps. So, if there is a specific work process that needs to be followed for a particular task, this is where you would want to identify that. Now, this section deals with personal protective equipment, or in short, PPE. Now, what kind of PPE do your workers use? Clearly with this, it depends on what tasks your employees are doing. This can just be an overview of the program of what PPE is available. And then when you get to what the task is, you don't necessarily need to say, for phlebotomy we use this kind of PPE, for housekeeping we use this kind of PPE. You don't have to drill it down that far. That can just be something you can do locally. What's important is that you list all of the PPE that will be used and available on site. You want to say where it is and who to speak with to obtain the correct PPE. And then you have your specific practices for how you use it. Now, you need to plan how you're going to dispose of that equipment when needed, especially if it is soiled or contaminated. Because, that's not something you can necessarily just dispose of in the normal garbage. You may need to clean and decontaminate it first, or you may need to have distinct biohazard containers. If it can break, or if it's sharp, it may need to go into a Sharps container. Now, there isn't a lot of PPE that would need that, but you've got to consider it. On to housekeeping. This section mainly deals with regulated waste. What do you do with your used Sharps and regulated waste? Where does that go? Housekeeping is concentrated on waste and cleanup. And in laundry, what articles are going to be laundered routinely by an employer? Whether you sent it out or it remains on site, you need to identify that. For example, if employees wear scrubs and those scrubs stay on site to be laundered, or if you contract an off-site facility to launder contaminated laundry, you'll want to state that. And in the event that there is no laundry facility and the PPE is all thrown away, you would want to state that as well. If it is all disposable, then you don't have to worry about laundry. But, again, say so your program clearly identifies the protocol. The labeling section covers who is responsible for making sure that contaminated or infectious items are clearly identified as such. Some instances will require biohazard tags, and others just a label saying what is in the container. Now, that's going to depend on what the facility policy is. For example, a site may use red bags for all infectious waste, so depending on the complexity of having different bags for different things, Osha is only interested with materials that are infectious and regulated. But if there is a potential for confusion on what something is, you'll definitely want to make sure that it is labeled. For storage areas, you would want to make sure that it is clearly identified, so you don't put infectious waste someplace else. For example, specimens and contaminated laundry. Contaminated laundry is handled differently than all your other laundry, especially in a hospital setting. So, you want to make sure that you have two clearly identified places of what goes where, so everyone is on the same page, and whoever is responsible for making sure that those things are done so that if there is a problem, your written program clearly identifies who you need to talk with. With the hepatitis B vaccine, you want to ensure that someone is in charge of administering it, so making sure there is someone who's responsible for getting everyone informed of the vaccination is essential. Whether they decline or accept, you will have accounted for every person and it will be documented. But where are they supposed to go get the vaccination? You want to identify that here. When an employee declines a vaccination, they need to sign a form called the Declination Statement, which is attached at the end of this document. You can also download a sample declination statement from the Oregon Osha website. You also need to identify who is going to keep those forms and where they're going to be kept. Possibly one of the most important sections of the written program is the post-exposure evaluation and follow-up. Anytime there is a needle stick, there are steps that must take place at the earliest convenience. If somebody has a needle stick that may carry HIV, they need to start treatment within 2 hours of that exposure. That gives them the best possible outcome. The timeliness on this is critical. Again, it is very important to identify who is responsible for reporting needle sticks, and where the injured are going for treatment is also imperative. There are specific things that need to happen as a part of the post-exposure evaluation. The employer is responsible for making sure that all of this happens. They don't necessarily need to do every step, but they do need to make sure that every step is followed. There are other aspects to this as well, like counseling and source individual testing. So, in essence, the post-exposure evaluation and the administration of that clearly needs to identify who, what, where, and when. In post-evaluation and follow-up, you must establish who is responsible for ensuring proper procedures are followed after an exposure. Now, if there is an exposure incident, you need to understand why. You want to know how did this happen, why did this happen, and how do we keep this from happening again. So, you need to evaluate all the different particulars of what was being used. Were engineering controls in use? Was it a safe medical device or not? If it was a safe medical device, what model was it? Have there been other issues with this particular device? If the injury wasn't caused by an engineered device, are there engineered devices that would help overcome future occurrences? These are the things you are looking at in depth. The person who is responsible for making these changes is identified as well. If changes need to happen, who is responsible for this evaluation? Is it a person, a title, or is it a department? Employee training is another essential element to your exposure control plan. Remember that the training must be done by someone who is qualified to do so. This is not necessarily just any trainer in general, as they clearly have to be a trainer in bloodborne pathogens. The rule doesn't require that you include everything to be taught in the training program, but it does require you to identify who it is. Now, including all of the contents that will be covered is not a bad idea. It allows you to plan better. So, identify where those training materials are located and make sure that they are available to all employees, employee representatives, and Oregon Osha. Training records need to be maintained, and who is responsible for that needs to be identified. Medical records also need to be maintained. Who is responsible for maintaining those and where those are kept needs to be identified. Remember, medical records need to be maintained for the length of employment plus 30 years. Medical records are confidential, so however they are maintained, make sure that they are kept in a way that only people with an actual need to know have access. This doesn't mean that they can't be kept on site, but it does mean that whoever has access to them must be limited. One thing also with the duration of medical records. If you are not maintaining medical records on site, and are relying on another clinic or facility to maintain those records for you, you need to talk to them about how often they purge their files. Many medical clinics will purge after 7 years. Either you can make arrangements to have them transferred to your facility, but only if you can maintain confidentiality. You do need to make sure that those records are available for current employees, former employees, employee representatives, and Oregon OSHA. Then there is the OSHA record-keeping area. A reminder that if your facility is responsible for keeping an OSHA 300 log, that all Sharps injuries are recordable on that log. If you don't have to maintain a 300 log, then all Sharps injuries must be recorded on a Sharps injury log. It's not required to list whoever is responsible for ensuring that the logs are maintained, but it is a good idea to do so. So, if questions or concerns arise, someone can be held accountable. If you would like more information on the OSHA 300 log, please visit this link here. Thank you for taking the time to watch this tutorial. We hope it has been helpful in your understanding of the Bloodborne Pathogens Exposure Control Plan.